Good afternoon, everyone. I want to thank these extraordinary leaders, these education leaders, for being here, for traveling to be here for this important discussion, and for the work that you each do every day, building the future of our nation and our world. So thank you each. I want to first address this weekend and the historic significance of the legislation that the Senate passed. Thanks to our President, Joe Biden, and his leadership, we are on the verge of signing into law the Inflation Reduction Act. And to put this in context, this piece of legislation will be the largest investment ever made to address the climate crisis. We are watching it, indeed. And with the Inflation Reduction Act, we're looking at an investment of just about $370 billion to address the crisis that is clear every time we turn on the television, from what's happening on the West Coast with fires to hurricanes and floods. This piece of legislation will allow Medicare to negotiate drug prices, which we know when we think about the cost of life, the cost of living, the burden of the costs of getting through the day, drug prices are a huge part of what is weighing down American families. We are going to see a cap on insulin for seniors of $35 a month. Not to mention the lowering of healthcare premium costs, and as we say, because it is the case, corporations are going to pay their fair share. So this is happening as part of the vision that the President and I laid out during the beginning of our administration, which is about taking on the challenges of the moment, and that related, of course, to the pandemic and what that was in terms of the need to get vaccinations to folks and get people back to work, to what we have always intended to do, and we are seeing the progress of building a strong and prosperous America. So when we look at this and where we are right now, we are very proud of the fact that in delivering for American families, we brought 40% of children out of poverty in our first year. Lifted 40% of America's children out of poverty in our first year. We rescued small businesses. We've seen historic job growth. In fact, we calculate at least 9 million jobs created, so we are now and have put all of those jobs back in play in terms of the jobs that were lost during the pandemic. And we are looking at the historic lowering of unemployment. In fact, the lowest unemployment that we have experienced in our country in half a century. So I say all that to say that we are proud of these accomplishments and the fact that NATO is strong, and we're actually going to grow by 2 members, and a bipartisan bill to address what we need in terms of reasonable gun safety, along with, of course, the nomination and the confirmation of Justice Ketanji Brown Jackson and what that means in terms of representation on our highest court, and the President's right decision as it related to removing the head of al-Qaeda. So all of that to say there is good work that has been done, but we recognize there is more to do. And so on the topic at hand, these leaders are leading at an extraordinary time for many reasons. They are building the future of our nation to meet the challenges of the moment. But we are also doing that in the context of a decision by the United States Supreme Court to take a constitutional right that had been recognized from the people of America, from the women of America. And let's note that we also understand and know that the majority of women who will be impacted by this decision are between the ages of 20 and 29. And so many of them are college age or will be attending college. And so I'm gathered with a group of higher education presidents and chancellors and with our Secretary of Education to discuss how this issue will uniquely impact the women of that age range and how it will impact more specifically women who are attending our colleges and universities. The principles that are at stake are, of course, that we must trust the women of America to make those most intimate decisions for themselves, and if they choose in consultation with their family members, with their faith leader, and with their physician. but the government should not be making this decision for her. And when we consider the reality of women in college, we know there are specific issues that will impact them, and we've been hearing from them. We know that women in college are uniquely impacted by restrictions on reproductive rights in that, one, women on college campuses, and this is a sad truth, are 3 times more likely to experience sexual violence. We know that many women in college have academic responsibilities. Many of them may be working as well to get themselves through college and pay for tuition in a way that will limit their ability to travel and will certainly make it almost impossible in terms of their ability not only to leave school but to afford to travel to where they may receive reproductive health care. So our administration has taken action to protect the reproductive care that is available and accessible to the women of America. In particular, the President has signed 2 executive orders which will protect reproductive health care, including permitting states to use Medicaid funds to help women travel and engage in interstate travel for care, within, of course, the limits of the Hyde Amendment. Also, our Department of Justice, the United States Department of Justice, has brought a lawsuit challenging the Idaho abortion ban and is clearly prepared to do more in terms of litigation as necessary to ensure that there is no conflict between these state laws and the federal law, which requires access to, and guaranteed access to emergency care. I'll close with saying this. Our colleges and universities are doing extraordinary work, and I know of work that is happening in particular around considering ways to protect students' access to care by instituting, for example, flexible attendance and leave policies so that students can seek care, by creating emergency funds so that students can afford care, and by clarifying confidentiality and privacy policies for campus health services. So there is good work happening here, and I really look forward to the conversation that we will have with these leaders, especially during these trying times. And so with that, I'm going to turn it over to the Secretary of Education, Cardona, to moderate and to start our discussion.
Thank you very much, Madam Vice President, for your leadership, but also for recognizing the impact that this has on our institutions of higher education, and for convening us today. The Supreme Court's decision in the Dobbs case has the potential to hurt students, faculty, and staff in our nation's higher education institutions. Students and others now have a new set of barriers to accessing health care, at a time when the pandemic has already put a strain on their mental health and overall wellness. Many colleges and universities are also concerned about how the decision will impact their medical teaching, their research, their ability to serve their communities. It has the potential to prevent them from doing what they do best. We've heard that from you. I'm encouraged that there are many colleges and universities and leaders who have stepped up to say that providing a full range of health care options, including safe, high-quality reproductive health care, will remain a top priority at their schools, especially in this moment. We must do everything possible to ensure that our students are safe and healthy so that they're able to learn and thrive. I look forward to listening today and listening to what we could do at the Department of Education to support you, but also in our whole of government approach to make sure that we can help the best we can. Thank you. Thank you for being here.
And Ted Mitchell, I want to thank you as the President of the American Council on Education. I know you're going to moderate the discussion as we move forward, in addition to obviously having the Secretary next to you and in this battle with you. Absolutely. So please.
Thank you, Vice President Harris, for having us today and for your leadership on this issue in particular. And thank you, Secretary Cardona, for your leadership and your consistent focus on student mental health as an important issue that we face from kindergarten through adulthood. Both connect, and I want to make three points as we begin. First, as my colleagues will attest, job number one for all of us who lead campuses is the safety and health of our students, our faculty, and our staff. We've shown that again and again in surveys that we've done over the last year at ACE. The pandemic has deepened the crisis for many of our students, faculty, and staff. And so we're already, I think, at a deficit in terms of the work that we do, and we're trying to catch up. The Dobbs decision has created one more barrier, one more impediment to universities addressing the needs, the mental health needs, the physiological health needs, and the reproductive health needs of our students. This is a real issue for our campuses. This is a real issue for our students. The second point I'll make is that the biggest challenge that schools, faculty, staff, and students face today is the confusion and uncertainty around a 50-state patchwork quilt of varying laws and guidance that, frankly, has only become more complex and more chaotic with the Dobbs decision. So the clock is ticking on every campus, every university in America to figure out what can and cannot be done to support students, faculty, and staffs, and in particular, to answer the questions whether their students do or do not have access to the full range of reproductive health care. So finally, today's conversation could not be more timely. Thanks to you, we have a unique opportunity to bring to the White House the perspectives and concerns from our college campuses. These leaders join us from red states and blue states, representing institutions large and small, public and private. They lead some of our nation's finest institutions. And while they represent diverse environments, they join you, Vice President Harris, and you, Secretary Cardona, united in seeking ways to support students, to support faculty, and support staff in seeking the broadest access possible to high-quality reproductive health care. And so with that, Madam Vice President, I'd like to turn it over to our presidents and chancellors to share their experiences with you. And I'd like to begin with Carmen Twilley-Anbar, who is the president of Oberlin College. Carmen?
Thank you. Thank you, Madam Secretary. Thank you, Madam Vice President. And thank you, Secretary, for this opportunity to talk about a really important topic. So at Oberlin College, we're the nation's first institution to be coeducational. We're the first predominantly white institution to fully admit Black students. And so the Dobbs decision is about more than a woman's right to choose for Oberlin's campus. It's about the fundamental and growing issues of inequity that this decision portends. Our institutional concerns are the country's, that these new restrictions impact women's essential right to live their lives as they choose, to have destinies that are unconstrained, where the pursuit of happiness is unfettered. And higher education at its core is about preparing young people to pursue their life choices. And young men and young women are facing mounting challenges to secure a quality academic experience and educational experience, and to make themselves heard among the increasing vitriol that passes for political discourse these days. So the Dobbs ruling dramatically worsens this reality. It disproportionately impacts women of lesser means, who are more often than not women of color, and it limits basic access to quality health care, oftentimes provided by organizations that are committed to reproductive rights. And college campuses tend to be microcosms of society, and so these inequities will play out on our campuses in the same way that they're playing out in society. But despite these concerns, as the vote in Kansas has demonstrated, the progression of our national debate on this matter will not be linear. Today's adversity represents an opportunity for all institutions of higher education to provide a venue where we can practice how to have difficult conversations and how we can listen more fully to each other. This country cannot move forward if we only celebrate the differences we agree with or the differences that we're comfortable discussing. So in this singular moment, higher education has a responsibility to help America conduct a more civil dialogue about a woman's right to make decisions about her own health care, and dare I say, about equity itself. So I suspect that our students on our campuses will be vocal, and they will push our democracy to fulfill its promise. Thank you.
Thank you, Carmen. Let me turn now to Audrey Bilger, the president of Reed College.
Thank you, Madam President. Reed College is fortunate to have made its home in Oregon, a state where access to abortion as a normal part of comprehensive reproductive health care is being diligently guarded and publicly funded. Yet, as an institution that educates students from around the country and the world, the Dobbs decision has put Reed College on high alert. Dobbs not only left in its wake an unwieldy patchwork of laws and restrictions that varies greatly state to state, we are also acutely aware of the threat of future decisions by the U.S. Supreme Court that could further erode the right to privacy by potentially restricting access to contraception or invalidating marriages between same-sex couples or criminalizing homosexuality or permitting the persecution of transgender and gender non-binary people. In Oregon, there may be relative safety, but college students are vulnerable to having their rights undermined simply by leaving the state to return to their hometowns, to engage in internships, or conduct research elsewhere in the United States. Reed is committed to making sure our students have access to information they need to understand their rights, no matter where their educational plans and aspirations may lead. As someone who came of age while Roe was in force, I learned from those who came before me that reproductive rights were hard fought and hard won. We cannot go back. Our nation's leaders must work to restore and protect the freedom to make private decisions about our own lives. I'm grateful for the work that the Biden administration is doing to champion these rights. Thank you for the opportunity to engage these issues with you.
Thank you.
Thanks, Audrey. Next, Roberta Cordando from Gallaudet University.
Hello, Vice President Harris, and also I wanted to mention Secretary Cardona. Our names are so familiar, so common. Oftentimes people confuse the last names, mine and yours. I am president of Gallaudet University, the only university in the world serving deaf students. We've been serving our nation since the Civil War. And this decision has truly shot an arrow through the hearts of many. For the deaf and disabled community, due process and equal protection of rights are critical. Now, Dobbs has challenged the future of equity and protective rights for reproduction. It's a great concern over these hard-won rights for marginalized communities. For us, we ask the same questions of ourselves when we were younger. We look to our students to understand how can we assure that young people such as themselves will have their rights protected, and more specifically, protections under the Americans with Disabilities Act, a civil rights landmark act that we hope will remain intact. How do we ensure that women with disabilities who suffer sexual violence at least 1.5 times more than other women, how can we ensure that they will have rights to care for their body and care for their health? These are the serious questions that our young people are being asked, and our work as a nation is to help address and answer those questions. Yes. Thank you so much for your time and the opportunity today.
Thank you.
Dr. Wayne Frederick, president of Howard University. Wayne.
Good afternoon, and I'd like to thank Vice President Harris and Secretary Cardona for the opportunity to speak today. First, I'd like to thank Vice President Harris for continuing to model excellence as a proud representative of the Howard University community.
You're welcome.
As the president of Howard University, I recognize that many in our community have concerns in the aftermath of the Supreme Court's decision in Dobbs. I speak today with two hats on. One as obviously university president of a very diverse and important student body, but also as a practicing surgical oncologist myself. Women account for approximately about 60% of students in higher education, and at Howard, an even higher percentage, 74% of my student body are young women. Howard has students from 46 states. So this decision is a very complex issue as we are grappling with parents and students who are moving back and forth, not just through breaks, but definitely through crisis. One of the first things that parents are apt to do is to ask a kid to come home, or for that matter, to travel to bring that kid comfort and care. And so this patchwork that has been mentioned of these laws will certainly prove to be a challenge. Issues such as aiding and abetting will continue to rise to the forefront, and especially for those who put their children at the forefront of their concern initially without looking up every single law in every single state before doing so, which none of us, I think, would do. would prove to be very complicated. Howard is going to continue to support our students and their healthcare needs through our student health services, our student counseling center, and our student life officers. One of the things that we are concerned about at Howard is that we actually send more African Americans to medical school than anyone in the country, and we've actually trained and graduated more black physicians than anyone in the country. This training becomes more complicated. We have an OBGYN residency at Howard University, one of the few that are housed at a historically black college and university, and therefore the burden that we have to carry to ensure that underrepresented women are protected and are given expert care with due diligence is one that we see as something that we have to be at the forefront of. So the response to this decision has certainly helped to shed some light on some of the most pressing healthcare disparities that the black community continues to endure. Black women are 3 times more likely to die in pregnancy and childbirth, and black children have the highest rates of infant mortality. So while there may be differences of opinion on the Dobbs ruling, we must all agree that reproductive health must be made safer for black women, and we must do more to support black women's choices. Thank you.
Thank you.
Thank you, Wayne. Let me turn now to Howard Gilman, who's the Chancellor of the University of California at Irvine.
Vice President Harris, thank you so much for gathering us for this very important conversation, and Secretary Cardona, thank you for engaging it. I come from a state that will continue to protect a woman's right to choose, but even in that circumstance, the Dobbs decision has created enormous challenges for our colleges and universities. I'll mention just a few. We have very important research collaborations with institutions around the country that will be dramatically disrupted by this decision. Many of our students, faculty, and patients find themselves in other states, and we are now thinking hard about how to extend our support to our community when our members of our community are in states that impose restrictions on care. Our medical centers anticipate a huge surge in out-of-state patients seeking access to reproductive care, and it is going to be a challenge for us to find the resources necessary to meet that demand. More generally, as was just suggested, the entire ecosystem, public health ecosystem of the country, in training people, the next generation of medical practitioners in family planning and obstetrics and gynecology, is going to be severely disrupted. And those of us with academic medical centers in particular have a special responsibility to work together to make sure that we can train that next generation in a way that meets this vital national need. And finally, we are very worried about the existing legal protections for our out-of-state patients, and especially for our out-of-state students who use our student health facilities, because the privacy protections around those student health facilities are different than the privacy protections that you see in other clinical settings. And so we hope that we can work together to address these issues, as we all are deeply committed to ensuring that our students have access to safe, full, comprehensive, state-of-the-art care for their reproductive well-being.
Thank you.
Thank you, Howard. Glenda Glover, President of Tennessee State University.
Thank you. Thank you, Madam Vice President, for your leadership and your stand on all the right issues. And Mr. Secretary, thank you also for your leadership. Tennessee State University is one of the largest HBCUs, and I happen to serve as the longest serving female president of HBCU. So I'm so happy to be here to have this discussion, because our goal around this table, our goal is for students to maximize their potential and be successful in the education environment. So if there are uncertainties such as reproductive health environment that affects them and affects their decisions, well, that also affects their academic success. So we want to make sure they have all the available information and knowledge that they need, because we don't know the implication of Dobbs, the long-term implications. So we have to plan for the analysis of the long-term effects on recruitment, and on graduation rates, and on completion, and other types of, in other environments. From a practical standpoint, Dobbs is so much bigger than the right to have an abortion. It's more about reproductive rights, and it's about states' rights when it gave so much power back to the states. So students must understand that and become more active in voting at various levels, at the state level, and understand the issues that are out there. Let your state representatives hear from you. They want to hear from students. They want to hear the student concerns. So you must encourage students to be more active in the civic environments. And finally, the health care. Make sure we have the accurate information that's given to the students, because anything that affects health care, especially maternal health care, prenatal, this is an extension. This is all tied in together now. Healthy pregnancies start long before a young lady is pregnant. And so the maternal care, all of this is tied into this. So we must educate students at a much higher level so they understand more about health care and the practicalities of health care.
Thank you.
Thank you very much. I'd like to turn now to Philip Hanlon, President of Dartmouth College. Phil?
Vice President Harris, first of all, thank you for convening this discussion and for your leadership on this really important issue.
Thank you.
Secretary Cardona, thank you for joining us. The Dobbs decision will have profound public health consequences, some of which Chancellor Gilman was just discussing. It certainly will exacerbate racial and socioeconomic health disparities and put sexual violence survivors further at risk. And as such, the decision is deeply distressing to many students, faculty, staff on our campus, as well as members of the surrounding community who have already given voice to this through statements and protests on our campus. As Secretary Cardona noted, we will do collectively as much as we can. Dartmouth will continue its unwavering dedication to reproductive health care, autonomy, and well-being for every member of our community. We will continue to offer insurance coverage to our students and employees that supports reproductive health in compliance with federal state law. And the Geisel Medical School at Dartmouth will continue its deep commitments through research and educational programs to reproductive rights for all, including childbearing decisions, maternal health, and effects on families. But despite all that we're doing, our campuses are concerned.
Yeah. Thank you.
Thanks, Phil. Last and certainly not least, my boss, Felo Matos Rodriguez from the City University of New York.
And the ACE board, to clarify the boss comment. So, good afternoon, and thank you, Vice President Harris. Thank you, Secretary Cardona. Thank you for hosting us today in this important topic, but also thank you for your support and the entire Biden administration of higher ed. We feel the attention you're giving to the sector, and we deeply appreciate it. I am proud to lead the City University of New York with our 500,000 students and an institution in a state where we're lucky to have the leadership of Governor Hochul and many elected officials who, right after Dobbs came out, took immediate action and doubled down on their commitment to support abortion and reproductive rights in the aftermath of the ruling. As our colleagues have indicated here, we're all grappling with the many dimensions of the Dobbs ruling, and I want to echo the many good points that were made. I don't want to be repetitive. And I do want to also highlight, we know that particularly when you're dealing with students who come from low socioeconomic backgrounds, students of color many times, access to, an unwanted pregnancy can be one of the things that derails higher education. Is one of the classic issues for students dropping out. That is a particularly large issue in our community colleges. We have 40% of our students come from that sector, and I want to highlight the importance as a former community college student, president in the South Bronx. I know what that means to that population, and I want to highlight that. My colleagues and the Vice President have spoken about the incredible need to increase our mental health support. It's something that I think higher ed knew they had to do better before the pandemic. The pandemic just made us acknowledge that, and this is added work in that area. But I also want to include, as we think in the mix, the members of the LGBTQI plus community who are understandably very fearful of the potential loss of their rights that have also been gained over generations of struggle. And I want to highlight that added component to the discussion here today. We have an obligation to keep all these students moving forward, to empower them to overcome all the obstacles that come their way, and to ensure that our campuses will continue to serve as catalysts, not only for student success, social mobility, but also for social justice.
Thank you. So with that, let us begin our discussion, and I thank the press for being here.